Are you ready, Governor?
Should everyone in the room buy a ticket to my fundraiser? These funds are my funds, these funds aren't your funds. I get to spend them the way I want to, and you can pass all the bills you want, because these funds were meant to be spent by me. These funds are my funds, these funds. I went walking past the people asking for money to feed their children. I walked right past them and gave out no bid for contracts. These funds were meant to be spent by me. These funds are my funds, these funds. I ignore outsiders, I don't like them. They did not donate to my election. I see business closing, that will teach them when you ask me to help them. I'll say you did not donate to me. These funds.
What do you want to do for the bridge?
I don't know. Do you have an empty hotel for rent? Or maybe some cheap golf carts you can sell me for twice the price? With business dying and owners crying, and their workers on corners begging, pool was over with people desperate and despondent. To the quickest, I give all rice checks. There's an election, I think I'll buy it. You'll never know until you try it. I'm not worried because I own the bank, and these funds were meant to be spent by me. These funds were meant to be spent by me.
Good morning, or good afternoon. It's Monday here in Kandit, and today we're going to talk about the Dog and Pony Show Part 2. Now, this is a recap and a further exploration into a developing story, because we have two hospitals on this island. We have the Guam Memorial Hospital, which is supposedly in the care of the governor, and then we have Guam Regional Medical Center, which appears to be in play. Now, the reason I'm talking today is in today's newspaper, there's a little story about nearly $1.5 million that was spent by GITA to the Matrix Group to create a long-term public health care plan for Guam. First I've ever heard of it. So I decided that I would go to GITA and get the relevant documents, and here's what happened.
Accurate.
We want to make sure that all of the requests that you're asking, that we give it to you.
I want to see the file.
Okay.
I want to see the documents in the file.
Okay.
For the Blue Continental Medical City Group,
Right, and then matrix file.
for a matrix file, and the Guam Regional Medical Center file. Why can't I look at them now?
Okay, give me 1 second, okay? I'm going to talk to them.
Okay. I'm sitting here at the Guam Economic Development Authority requesting files, which I am allowed to see under the Freedom of Information Act and Guam Sunshine Law. These are files that should be readily accessible, so I don't understand why the staff here at GITA is telling me they have to compile the file to make sure that the files are accurate. There should be no filing, there should be no compiling required. They either have the documents or they don't have the documents. So this is, we'll see what they come up with. I hope that I don't have to go to court again, because every time I go to court, it's $300 to get the government to follow the law.
Can you give us a FOIA request?
I don't need to. According to the law, I can come here and ask for access to those files.
And the files, which files are you looking for?
Blue Continental Group Medical City, Guam Regional Medical Center, and Matrix, Design Matrix.
More particular, is there something you're looking for within those files?
I want to see the entire file for Blue Continental Medical Group. I want to see the record of the public hearing on the private activity bond. I want to see the RFP for Design Matrix for the healthcare analysis. I want to see the Design Matrix file, and I want to see the annual reports for Guam Regional Medical Center.
Okay, so with that in mind, those files need to be, they're in different places within the organization, different managers have them. So we can't give you anything yet. The manager, is anybody here right other than? No. So until we get our deputy or administrator to allow for it, I can only say.
Wait a minute. A deputy administrator has to authorize a citizen to have access to government files.
Absolutely. Our executives have to approve this before we do anything. So I just
where in the law does it say
I don't know the law. That's why I just want to be clear. I just don't know what we can give and what we can give out and what we can't give out. I need to confer with my bosses to find out, can we do this? I just don't know the law. In that respect, sir.
Okay, so what you're telling me and clarifying this, you're not going to give me access to any of these files until you clear it with your bosses and legal?
No, I don't think it has to go to legal. But they need to know that a citizen's coming in. I don't have access to those files.
What do you mean you don't have access?
It's not in my department. I'm not exactly sure where they're at.
Okay, so what's your title here?
I'm the business development manager.
Where are the files for Gita? Where are they located?
It could be under a different manager. It could be in under the executive office. Those are contracts. I don't have access to them right now.
When could you have access to those files if I decide to wait?
Well, you can wait as long as you want. When the administrator or when the deputy comes in, we can confer with him to find out what we can do. I'm just coming out here because I don't have access to that information myself. I'm not even sure where it's at. Because different managers have different things. I don't have access to those.
Okay.
I'm just trying to.
When will the deputy manager be in, or the deputy?
He's on his way in.
Okay.
You want to stick around for a while?
I will stick around for a while.
Okay, and I know you're recording this.
Yep.
I'm just letting you know, I'm just trying to help get information to you. I don't have a problem with it.
Okay.
I just don't have the information.
Okay.
So just want to let you know.
Hopefully he will have access to the information, but it's a little concerning to me. You're a manager here.
I'm a manager, yes.
And you don't know or have access to critical files.
I don't handle the matrix contracts.
Okay.
So it's a different manager has it.
Oh, okay.
So these contracts are signed off by the administrator. So a lot of it would be under the administrator. I don't have access to that until, I just can't go and open a file and pull something out.
Okay.
So
I'll wait.
Okay.
Thank you.
You're welcome.
Thank you very much.
You're welcome.
As we see here, we're running into problems. Now, over the years, I've probably submitted somewhere between 150 and 200 FOIAs to different agencies of government in Guam over the years. And I have never had any problems getting access to the documents that I've requested until this administration. So on the campaign trail, when candidate Leon Guerrero promised that she was going to have the most transparent administration ever, was she lying? Well, I think the fact that I had to take her to court and have a judge issue orders for her to release some documents that we'll talk about later, I think you can judge from yourself whether her campaign promise of transparency was an honest promise or a lie. You see, what politicians are counting on is voter apathy. They are hoping that you out there forget what they said on the campaign trail and let them run about, do what they want to do without being accountable to the citizens. And they get away with it as long as we don't ask them any questions. So let's take a look at another situation where we have a little video clip coming up here where we have Governor Leon Guerrero. Now, is she telling us the truth or is she telling us a lie? Let's find out.
First, let us make something crystal clear. There is no way we're going to be able to spend the $300 million in federal dollars on a new hospital complex. The state and local fiscal recovery funds made available in the American Rescue Plan that comprise that remaining $300 million have deadlines that do not coincide with even the most optimistic of new hospital complex projections. Of the remaining $300 million, all of it must be obligated by 2024, and all of it must be expended by 2026. Senators, you're familiar with our project timelines. Even Simon Sanchez, after 4 years of this administration, is still in the planning phase. And as large of an undertaking as that is, it is nowhere as complex as the new hospital rhetoric that just keeps getting bigger and bigger and bigger. 2024, the deadline to obligate these monies, is a year and a half away.
And I'll tell you, we will build this hospital in less than 4 years. And to say that, well, and for example, Nestor, he's talking about the planning, the charter aid. We've already done that. We already have a plan. We've met with the medical professionals. So we're way ahead of his plan.
And there you have it right there. One thing that I appreciate about our congressman is the way he keeps everything limited to the facts. And I know this to be accurate because a study of over 2,000 environmental impact statements, which would be required before building the hospital, says that the average environmental impact statement takes between 3 and 5 years to complete. And we heard the same information from the Army Corps of Engineers when they were talking about the charrette process. Remember the one the governor said has already taken place? Was she telling us the truth or was it a lie? I am a stakeholder. None of the doctors I've talked to claimed have been invited to any of these charrettes that supposedly took place involving all the members of the community so that a comprehensive plan can be put together. All we got was this newspaper story that sometime last year, the governor spent $1.5 million with an off-island consulting firm to put together a plan. And I can guarantee you that plan didn't include any of the community stakeholders because I never heard about it. None of the doctors I've talked to heard about it, so they weren't involved. So going back to the statement, you know, it takes 3 to 5 years to do an environmental impact. And all we've got from the governor, based on, no, I forgot, right here. This is the lawsuit that I had to file, well, legal action I had to file against the governor to get her to release FOIA documents. She should have followed the law and released them to me, but what she released was basically a nothing burger. Here's her acknowledgement that was given to me on Thursday last week, just the day before the deadline with the judge. And all she had to report, now bear in mind, we've got a $1.5 million expenditure, and yet all she has in her hands right now is an email outlining the meeting with the meet and greet she had with the Corps of Engineers, and 4 pictures. Now I went to the Army Corps of Engineers and downloaded their report to the governor that was done back in 2019. And basically in that report, they outline whether you renovate the existing GMH or build a new one, there are $21 million worth of repairs that are critical to the functioning of this hospital and would assist it in getting joint certification, whether we certify under this building or a new building. These are things that need to be done irregardless. So, where are we now? We got this $1.5 million healthcare study that the Gita has refused, despite months and months of efforts by the Pacific Daily News to get a copy of these reports. And as you heard earlier, the Gita is basically slow rolling me. So I filed a formal Freedom of Information Act, and I told them that I expect to be allowed to visit those files as soon as possible, but no later than noon on Friday, because we're talking about a lot of money. And what we know right now is that requests for information from the news media are being denied, in spite of the fact that since July, Gita has confirmed that they have the report. So let's take a look at Matrix Design Group. When you look at Matrix Design Group, they have done a compatibility study here on Guam. Hooray! You know, they're a military contractor, and when you look at their website, you see a whole list of projects that they have done for the military. But when you look at their principles, you know what you don't see? Healthcare experts. That causes me a lot of concern. I would have had a lot more comfort. I would have had a higher level of comfort if instead of spending $1.5 million with Matrix Design Group, we spent $1.5 million on a consulting firm that specializes in designing hospitals, that has designed and supervised the construction of more than 400 hospitals and related facilities around the world, like this group, the Huddy Group.
Trauma alert by ground, 10 minutes. Trauma alert by ground, 10 minutes.
In the emergency department, every second counts. Robert Wood Johnson University Hospital's Level 1 Trauma Centre sees approximately 95,000 patients per year, and medical professionals at this New Brunswick hospital in the US state of New Jersey say patient traffic has increased between 3 and 5% over the last few years. They've teamed up with Huddy Healthcare Solutions to develop a state-of-the-art adult and pediatric emergency department to better cope with the increased patient load.
No one wants to go sit anywhere and wait and wait and wait. So the more quickly you can get a patient in, get in front of the doctor, the more satisfied they are. That's why they come. They come to see the providers. So the more quickly we can do that, the better it is.
John Huddy leads Huddy Healthcare Solutions' specialised ED design team, and he brings the experience of having worked with ED doctors and nurses on over 300 emergency departments worldwide.
If we could understand what new flows are out there and push our clients to look to the future, we can design around more efficient and effective processes. It's all about getting the patient to the provider more quickly. It's about designing communication and workflow and all of that to better support the clinical staff so they can better support the patient.
In a bid to improve emergency department workflow as a key driver during their planning process, this emergency department has added an innovative care initiation area. Appropriately selected patients are moved to these seats while they wait diagnostic testing results.
So many times across the country and around the world, people are sitting out in waiting rooms awaiting an exam room. What this allows is it frees up that space so that in a much smaller area where they can actually privately wait for results means that we're freeing up exam rooms. We have less people waiting in the actual public areas.
Huddy Healthcare Solutions believes every emergency department is different and requires unique insights during the early planning process.
Senior staff at this New Jersey hospital were part of the team tasked with designing their emergency department. Huddy Healthcare Solutions believe this collaborative approach provides the best results for staff and patients alike.
Catherine Mangarelli is the Assistant Director of the Adult Emergency Department at Robert Wood Johnson University Hospital and helped oversee the transition to the new Pediatric and Adult Emergency Departments. She says input from medical professionals in the design process is vital.
You really want to make sure that you're not just designing something without the proper resources and the input from the staff who has to be working in that environment to make it work. You can build something beautiful, but if you don't have an efficient workflow and it doesn't work for the staff to be able to provide the care that they want to give, it'll fall apart.
This emergency department now includes some specially created spaces to help provide more appropriate, personalised care. One example is this room, designed to protect patients that could pose a threat to themselves and others. The paediatric emergency department also has a sensory room to foster a better environment for patients with autism. Those here say they're now more equipped to handle a diverse patient population.
We are fortunate to add 100 new beds to provide capacity to our patients. In addition, we have radiology and CAT scan ability in our department, as well as a separate pediatric department. We have a new trauma bay that can welcome up to 8 ambulances simultaneously.
During the design process, Hardy Healthcare Solutions provides unique analytical tools and interactive demonstrations so staff can experience their new workspace before it's open to the public.
By building a mock-up and having people role play, it really creates the sense of this is a bit more real and how this process might work. And so it kind of embeds new ideas and new practices in the minds of the staff.
And by incorporating staff feedback and with a focus on future streamlined operations, Hardy Healthcare Solutions is considered a leading innovator in delivering emergency department planning solutions that meet both the patient and the staff's needs.
Now, I'm not saying that Matrix Design Group is a bad company. Far from it. They're probably a very good company at what they do. But when I looked at their website, I didn't see the same things that I saw when I looked at this website. A history or a client list that includes over 400 of the top medical institutions around the United States and the world. That's the kind of expertise we need. We need people that are in the healthcare field, that understand the healthcare field and have 35 to 40 years experience at working in the healthcare field. But what we've got here right now is, as you saw from my encounter at Guam Economic Development Authority, we got a whole lot of nothing right now. And that concerns me because the governor's talking about spending $1 billion on a project that right now doesn't exist. She claims that the meetings have taken place. Is she telling the truth or is she lying to us? Well, I'm a stakeholder. I never saw any notice on any of these meetings. None of the documents I've received from Guam Memorial Hospital, from the governor's office, from Department of Administration verify that any meetings have taken place. She claims that she already has a plan, but based on the documents I've received is she telling the truth or not? Well, based on the documents I've received from her office under court order, I haven't seen a plan. She claims that she's going to spend this $300 million within 4 years. But if she hasn't got the site control, hasn't done the environmental impact statement, hasn't got a plan, hasn't held the meetings, how is she going to build this building in under 3.5 years? Now that's Guam Memorial Hospital, but that's not the only concern I have right now. The other concern I have right now is that the nonprofit purchase of Guam Regional Medical Center. You see, we have 2 hospitals on this island the public has access to. Guam Regional is the other lifeboat. And I have some concerns about that. And let's start with the audio clip taken from the public hearing. This is audio clip 1.
and Wednesday, November 24th in the Guam Post. We will now hear from any person who wishes to speak about the proposed financing. What we'll go ahead and do is, if you wish to speak on the proposed financing, will you please identify yourself in the chat box, and then we can call on you in the order in which you appear in the chat. Also, in advance, I apologize for the slight delay in getting connected. We had some connectivity issues on our end. But let's go ahead and give it a few minutes to see if anyone signs up to speak. Congressman, do you have a question?
Yes, before I actually begin using my time, I did request from Gita copies of whatever supporting documents the agency is using for this process, and we never received any.
Okay. Do we have any?
Only the ad is what was forwarded to you.
No, but do we have any other documents?
No.
Gita does not have any documents related to the transaction at this time, but we can forward to you subsequent documentation. I mean, anything we receive after.
I'm curious about Gita's role in this process and the tax-exempt nature of the debt. What is Gita's role in this process, and how is the tax-exempt status being applied, the territorial tax-exempt status being applied to the debt? Is this a government financing?
Sure, I'll go ahead and defer to our public finance manager, Tina, to explain.
Good day, everybody. My name is Tina Garcia. I'm public finance manager here at GITA. What is being presented today is a request for tax exemption under the IRS Code 1986 by the Blue Continent Healthcare Guam Medical City LLC. This is their borrowing for tax exemption. There is no government liability tied to the borrowing, and there is no liability on GITA. So after we review the plot, after this public hearing, we will then work with our bond counsel, who will then assist us in ensuring that all the steps were taken to ensure that the government had done all the steps to allow for the tax exemption for the borrowing for this service.
Now, I don't know about you, but what I heard there is very, very alarming. The fact that we are holding a public hearing with no documentation. Now, think about that for a second. The way the public hearing process works, at least supposed to work, is that there will be some documents created. The public then has an opportunity to review these documents and prepare questions based on the information they receive. And what we heard right here is Guam Economic Development Authority telling the congressman there are no documents. Well, if there are no documents, why are we having a public hearing? Why are we doing a public hearing in advance of authorizing a private entity to borrow $600 million, putting taxpayers of Guam at risk? Now, you heard Tina over at GITA say there is no risk to taxpayers. How the hell does she know? She doesn't have any documentation. And the reason I bring this up is, those of you who know, I've been battling GRRP for years, and for years, GRRP spokespeople have been saying, oh, there's no risk. But when you read the contract that GRRP created, the private activity bonds will be guaranteed by GITA and Government of Guam against the general fund. That's in writing. Here on this private activity bond for $600 million, we have no documentation other than a staffer's assertion that there's no risk to the people of Guam. Is she telling the truth, or is that a lie? We have to be very, very careful when we ask these questions, because it's just like the situation that happened during the pandemic when the governor was handing out contracts without any documentation whatsoever. Is she about to hand $600 million of taxpayer money or taxpayer guaranteed money to a private entity that we don't even know who they are? All we know is they are a Delaware nonprofit. And we have a lack of documentation. Let's go to audio clip 03 in full screen.
Okay, great.
What guarantees do we have that something like that won't occur?
Okay, great. Thank you for your comments, Congressman. If there's nothing further, the public hearing is now closed.
I do want to add another item, and this is very, very important.
Congressman, can you wrap up your commentary? And of course, you're welcome to submit anything further in written commentary, and then anything further that GITA receives relevant to this transaction can certainly be forwarded to your office. But go ahead and you can go ahead and speak, sir.
Yeah, I find this hearing to be very rushed. I find this hearing, I don't feel like GITA is in any way trying to make sure that the concerns that are being raised are actually going to be vetted before any action is taken. I feel like this is all pro forma. I feel like this is some kind of political favoritism being conducted on behalf of GITA and on behalf of this administration, because the finance campaign chairman is the one who's spearheading the action here. He's not even answering any questions because he knows it's just going to be checked off. This is not the way we do business on the government of Guam, and this is not how we go about attaching our island to $600 million in debt. The PROMESA concern, the concern of there having to be some kind of callback in the event of a default, is very real. And if the GRMC is a going concern as a private entity, it's going to continue to be one as a nonprofit potentially, and that is something we really need to take in consideration before attaching Guam to this in any way, shape, or form. So I really hope that this process is not going to turn out to be some kind of, check off the box because the law said so and we did it and we're just going to go forward and the governor's already said she's going to sign off. We have a responsibility to the people of Guam, and that's why we're having this public hearing. So I hope all these concerns are taken seriously and the answers are provided and the concerns are fully vetted.
Excellent. All right. Thank you for your comments, everyone. Thank you for your comments, Congressman and Speaker as well. Unless there are no further public comments, we'll go ahead and the public start. Did you want to provide comment? No?
I just kind of came late and everything else, so I don't know whether comments have already been made or not.
We're just wrapping up public comments now, but if you'd like to make public comment, we're willing to hear.
Yes.
Okay, let's go ahead and face the camera to the gentleman. For the record, please, sir, please state your name, your address, or the entity that you represent.
My name is Felisberto Alfred Duenas, and I work for the office of Senator Joanne Brown. And the public comment that I would like to make, this is the second time that you had a private hospital seeking financing, operations, and everything else. First being the Catholic Medical Center or whatever, where the current GMH is at. And the scenario back then was that the old GMH was the old location was dilapidated and needed repairs and everything else. The Catholic Church decided to build their own hospital, and somewhere along the line they ran into problems, and GITA helped them out and everything else to bail them out. Required going to federal to Congress to do some laws and everything else to make it possible. And one thing is that this is the second round, and this hospital is entertaining a financing in the amount of $600 million. And when you look at the cash flow needed to service a $600 million on financing, considering that it is a for-profit, and they must have other liabilities and responsibilities and everything else. And it is a multinational corporation, and that they've got affiliates over, in the Middle East, and then, of course, in the Philippines. So, my only question is, after all is said and done and everything else, and it fails, would it be an opportunity for the public to say, okay, we'll bail you out, and we don't have to build a hospital, we'll take over your facility, replicating what had happened back, when the church failed to develop the hospital, to fully finance the hospital. I mean, the medical center that fits together everything else was the Catholic Medical Center at one time. It was located down in a canyon. That's the original Catholic Medical Center. And they moved up and everything else. So that's my only concern, is that are we going through the same scenario, different players and everything else, with the key player being GMH? And that's it. And I think for the GMH thing, if you go into your archives and everything else, you would find what GIDA did to facilitate it.
Right. Thank you, Mr. Duenas, for your public comment. We appreciate it. All right, if no one wishes to submit further comments, if you'd like to submit written comments, they can be included in the record of this hearing. And without any other business, the public hearing is now closed. Okay.
That was GIDA Executive Director Melanie Mendiola. Now, there's a couple problems here that we need to address. First of all, as Mr. Duenas brought up, the possibility that we may be setting taxpayers up for the big drop. When I say the big drop, there's no proof that no risk is on the backs of taxpayers. And I've been concerned this whole time that this administration is planning to buy Guam Regional Medical Center. And we don't know whether they are or not, because they refuse to release the documentation. And I'm hoping I don't have to spend $300 on Friday to file another lawsuit against GIDA to get the information that would prove to me whether or not Guam Regional Medical Center is in play. And that is very concerning to me. And it goes back to the fact that we're holding a public hearing with no documentation, and we're getting ready to have the governor on her sole authority to approve a $600 million private activity bond they claim doesn't put the government of Guam at risk, but they offer no proof. And then there's the other shoe that needs to drop. Who are Blue Continent Group? Well, I went to Rev and Tax, and I pulled all the files related to Guam Regional Medical Center, Blue Continental, Medical City Group, Guam Health Partners, whatever they are, that developed it. And what I found out is that we're looking at a Delaware nonprofit, which is a big red flag for me. And the reason is because here we are, we received a foreign corporation filing at Rev and Tax, and in February, they were a corporation in good standing. But in June, they were not a corporation in good standing because they haven't paid their taxes in Delaware. Just what we need here on Guam, another company coming in here promising big things like GRRP did and not paying their taxes. Remember, cease good standing. I looked it up, and there it is in the Delaware. So the biggest red flag right now is the fact that this is an anonymous Delaware company. Think Panama Papers, if you will, hiding the true ownership. We don't know who really owns Blue Continent Healthcare Group, but the governor's perfectly willing and ready, apparently, to hand them $600 million of taxpayer guaranteed funds. Is she telling the truth? We'll see. Because I find it odd that a former bank president who wouldn't loan $7 million to Guam Memorial Hospital because they didn't have enough collateral is ready to sign a document giving $600 million to a company that has no paperwork. We haven't vetted the financials. We don't know who the principals are. We don't know if they're even credible operators. We don't know if Guam Regional Medical Center is a good risk. I think Guam Regional Medical Center may be in the same level of financial trouble as Guam Memorial Hospital, because when they built Guam Regional Medical Center, they didn't solve the main problem on this island. And the main problem was that 75% of the residents of the island of Guam don't have adequate health care coverage. That's why Guam Memorial is over $100 million in debt. And that debt grows every year as people use the emergency room as their primary care physician and aren't paying. And it's also compounded by the fact that Guam Memorial Hospital, under this governor and this administration, do very little to collect the money owed to them. So, is this sale of Guam Regional politically driven? I don't know, but you heard the congressman talk about the fact that the governor's campaign chairman, who at the time was co-chairman, was Francis Santos, was sitting there and behind this effort to get the $600 million. To me, it sounds too much like a sting. It sounds like a con game. It's too much like, Bernie Madoff, who took billions of dollars away from unsuspecting investors. Because back in 2018, when the governor was running for office, I tried to convince the government to put Guam Memorial Hospital into a federal receivership to take the politics out of the island's healthcare lifeboat. But despite promises by the governor, that didn't happen. Well, despite promises to appoint competent management to the hospital, which didn't happen, despite promises from the governor that she would find the money to fix the labor and delivery room, nearly 10,000 children have been born in those dilapidated facilities. So, is she telling us the truth or not? You get a chance to decide, because right now, the governor's sitting holding on to $300 million of American Rescue Plan funds that were supposed to be used to benefit the people of Guam. Now, we know Guam Regional Medical Center was built at a cost between $250 and $300 million. My concern is that the way this private activity bond is playing out, the owners of the facility are looking to cash out on a $600 million payday, which goes back to a saying from famed investor Warren Buffett, the CEO of Berkshire Hathaway, who says that more money is stolen at pen point than gun point, which pretty much sums up why the governor may be sitting on $300 million of taxpayer money to use it as a down payment on $1 billion purchase of Guam Regional Medical Center. This is speculation on my part, and the reason it's speculation is I have not been able to gain access to all the documents I've wanted despite court orders, because all the documents I've received from the Department of Administration, the governor's office, and Guam Memorial Hospital are not consistent. They're not coherent. They're not in congruity with a plan to build a new hospital. So, what I'm looking at is primary politics. Remember, George Satayama, Spanish philosopher, who said, those who do not remember the past are doomed to repeat it. We had a lot of promises in 2018, and as far as I can tell, none of them, especially when it came to public health and Guam Memorial Hospital, have been kept. So, are we going to allow the people who broke the system even worse 4 more years to prove how much more they can break it? Or do we use this primary election, and everybody knows that I've been trying to eliminate the primary elections forever? Well, here's an opportunity for us as citizens to make the primary election work for us. To start with, my recommendation is don't vote for the current administration. You hear the difference between, at the opening of the show, the difference in point of view between Mike Nicholas and Leon Guerrero. Which do you think has a more realistic opinion about what it's going to take to fix Guam Memorial Hospital? Based on what I've heard and what I've seen, the answer is obvious to me, and that would be Michael Nicholas. But we can't stop there, because we have to remember that the legislature is the people's house. And for the past 4 years, it has not been the people's house. It's been the House of Blue. So what we need to do this primary election, and use the primary election to work for the people for a change, is to change the makeup of the legislature and make it the people's house once again. So how do we do that? Well, we look at Bill 1136, which was introduced in the first days of the 36th Guam legislature as a way to limit the curbs of political abuse, emergency power abuse. Because here we are in the midst of supposedly a public health emergency, yet the governor has been posting all these videos of island-wide rallies and a motorcade, and I didn't see people social distancing, yet we're still in a pandemic. But what the reason the public health emergency does is it gives her the sole power to use federal funds as she sees fit. And that's not necessarily in the best interest of the people of Guam. So how do we recreate the people's house? Well, let's start with, on the Democrat primary, let's eliminate all the senators who refuse to allow the legislature to have oversight over the emergency powers after 90 days, guaranteeing the governor sole power over federal funds, starting with Tina Barnes, who, by the way, was one of the masterminds behind the massive retroactive pay raise that gave senators a $30,000 pay raise in 2014, and was also one of the architects behind the flawed Simon Sanchez bill that almost cost taxpayers $60 to $70 million more than it should. And she's also the person behind the legislation that financially gutted Guam Memorial Hospital. And legislation that I might add was also ruled illegal in federal court. Followed by Sabrina Perez, who also salutes when the governor has orders for her, as does Joe San Augustine, who also is one of the key people behind keeping that business privilege tax in place that has yielded a $100 million surplus for the governor of Guam, and Amanda Shelton, another Adelup loyalist, along with Pito Terlahi. If we eliminate those 5 people and put in place brand new candidates, and there are a lot of good people running for the first time under the Democrat primary. So if you vote for the new people, then maybe, just maybe, we will be able to restore the power of the people in the people's house and have the legislature serve the people first over serving the needs of Adelup first. We have a general election, we have the primary election this Saturday. I encourage every one of you watching this video to share this video with your family, friends, and co-workers, because together, when we go out and vote, we can use this primary to start realigning the politics of this island and turn the legislature into the people's house once again, and eliminate this administration and put in place a potential administration, be it Mike Nicholas or Felix Camacho, that will put the people first when it comes to our public health care program. I'm Leon Guerrero. This is my point of view, and remember, share this video with families, friends, and coworkers. They need to know the risks that we are taking as we move forward under this administration. And we need to stop it. It's up to us, because we know politicians are not going to put the people first. They haven't for 4 years. Why would they do it now? Contrary to what they're going to promise us in these last days of campaigning. Leon Guerrero with my point of view, and I'll talk to you again next week.
We want to personally invite you to visit our beautiful island. Warm weather and warm smiles are waiting for you here.
While there is a global concern for the 2019 novel coronavirus, we want to assure you that we have layers of defense, starting with our airlines and our airport to keep everyone healthy and safe. As of today, we have no confirmed cases of coronavirus on the island.
We are excited for you to explore and experience our island paradise. We look forward to seeing you soon.
Doesn't need to be a lawyer to see something's not right with the Leon Guerrero Tenorio Administrations emergency procurement handled by Governor's legal counsel, Hai Hyun.
I've never heard of verbal agreement, by the way, as a governor, and I've been 20 years in public office as a senator and a governor. I've never heard of a verbal agreement in any government capacity, which it seems to have occurred in this pandemic. And it seems like the paperwork is catching up after the verbal.
GURA Executive Director Ray Tapasnia says Guam's homeless numbers for 2018 were at 854, or 51 in 10,000, putting our per capita ranking at second.
But more importantly, when the hell are we going to start tourism up again?
Look how we were discussing about the ARP, and one of the things that we wanted is for the governors to have discretionary power over the ARP, and that happened, right? We were given, and I'll tell you, my senators in Guam are very upset because they cannot appropriate the $596 million that was given to us. I'm going to first fix the roof. Make sure the roof is okay, all the windows are caulked so there's no leakage.
Calvo calling out Adelup Communications Director Janela Carrera for muting the media, saying elected leaders must answer tough questions. He added that Adelup's messaging during this COVID crisis leaves much to be desired.
I have authority to take money, I have authority to take property, I have authority to move personnel wherever I feel they are needed to be. So yes,